Good day everyone, I'm Zarina Alimahan Legarda from BSN1 Nightingale. In this video, I'm going to demonstrate the proper way of shampooing a patient in bed. Before meeting the patient, review the patient's information. Upon meeting the patient, introduce yourself, identify the patient using at least 2 identifiers, and explain the procedure to the patient. Ma'am, good morning. I'm Zarina Legarda, your student nurse for today. I'm going to assist you with washing your hair using shampoo and water. Could you please state your name and your birth date?
My name is Ian Legarda, born on September 23, 2003.
Thank you, ma'am. So, shampooing is done to help scalp circulation and to maintain scalp hygiene. It is to remove oil and dirt from your hair and your scalp, and it is also done before scalp assessment. So, are you comfortable in your position?
Yes.
Do you want me to put additional pillows under your shoulders?
No.
Okay, so before I begin the procedure, ma'am, I'm going to wash my hands first and prepare the materials needed. Is that okay? Thank you. Prepare the needed equipments and perform hand hygiene.
Ma'am, just wait a second. I'm going to put on gloves. So I've already done hand washing and I'm using clean gloves. Ma'am, let me remove your hair tie. So I'm gonna put you into a sideline position and put this rubber sheet under your shoulders. I'm gonna get a towel and I'm going to put the towel over this rubber sheet. Line a towel on the patient's chest. Cover the patient's ear with cotton balls. Put a damp towel on the patient's to cover the patient's eyes. Inspect for any abnormalities in the patient's hair and scalp. Now I'm going to comb your hair. Just tell me if it hurts. Mix hot and cold water. Gently wash the patient's hair with water. Mix shampoo and water in a basin. Apply shampoo on the patient's hair. Now lather it from the hairline to the patient's neck. Massage the patient's scalp. Next, we're going to rinse the patient's hair with water. Now that I have rinsed the patient's hair with water, I'm going to remove the cotton balls from the patient's ears. Remove the damp cloth from the patient's eyes and tap the patient's face with the cloth. Using a dry and clean towel, we're gonna have to pat dry the patient's hair. Once excess water is removed, dry the patient's hair with a blow dryer. brush the patient's hair. Remove the towel covering the patient's chest. And the towel and rubber sheet under her shoulders and neck. Assist the patient to a comfortable position. So, ma'am, I am done with the procedure. Thank you so much for your cooperation. Are you feeling better now? So again, thank you so much, ma'am. I'm done, and I will take my leave now. Just call me if you need anything.
Good morning, everyone. My name is Ian Eligarde from BSN 1 Nightingale. Today, I'll be performing a written demonstration on tepid sponge bath. So, let's start. Good morning, ma'am. Can I come in? So, my name is Ian Eligarde. I am your nurse for today. And may I ask your name, ma'am? Your birthday, ma'am? September 26, 2018. So I am here today because I am going to do a tepid sponge bath on you. Is that okay with you? So before I start, I'm going to read a chart. So here is a doctor's order that you should need a tepid sponge bath to reduce your body temperature. I want you to sign in here, ma'am. So I'll be back, ma'am. I'll do hand washing and also prepare the equipment that we're gonna use. So I'm already done hand washing. So the equipment that we're gonna use is we're gonna use a we're gonna so make sure that there is a privacy. We need to close the curtains or windows and also close the door. And we're gonna replace the bed blanket with patient blanket. And now we're gonna assess the patient to remove her glove. And now we're gonna check the patient temperature. Okay. We're gonna record it on our note or on our book. And now we're gonna add our tepid water into our basin. Check the temperature of the water. And now we're gonna soak a cloth. Squeeze it to avoid dripping. And now we're gonna place our towel into our patient chest. Now we're gonna turn temperature. And we're gonna record our data. And now, I'm gonna turn my patient again into a lateral position. So, punch her back and sorry. And also, her lower extremities. From the knees and knees to thighs. And after that, we're gonna repeat the procedure until the patient body temperature reaches above normal. So with the remaining cloth, we're gonna pat dry the patient to avoid chills. And now, we are done. So, we're gonna remove our gloves. And we're done. So this is how you do a tepid sponge bath.